less than 0.9. In this case, we'll assume it's normal. The next thing to do now is to perform the burger test. Just keep your legs straight, both legs, and lift it up, please. Alright? Both legs straight and lift it up. Come on. Keep both legs lift up. And then you watch it for 10 seconds. Alright? And then you see the legs become pale. If there is peripheral arterial disease, both legs will be pale. Then I just want you to keep it up there. Put it down, let it floppy. Put it down. And let it go floppy. Like all the way down, let it go floppy. Just free it. So normally, why it was pale when on elevation, when she brings it down on dependence, it becomes red. So that confirms a positive burger test, which is suggestive of peripheral arterial disease. In this case, there was no paleness on elevation and there was no redness on dependence. So she has a peripheral, the burger test in this case is negative. If I had more time, I would also like to check for Romberg test and also for coordination. Alright, but we'll skip that in this case. So, thank you for that. So, in order to end my examination, I would like to request again some other tests like fasting blood sugar. I would like to request it, and I want that to be less than 126 milligram per day. I also want to request the hemoglobin A1C, which I would like to be less than 6%, or ideally less than 5.7%. I would also like to request the patient go for follow-up to see a cardiologist because of a risk of coronary arterial disease, to see a neurologist because of the risk of peripheral neuropathy, to see a podiatrician because of the risk of having Charcot joint of the ankle, to also see a nephrologist because of the risk of kidney disease. Remember, diabetes is the most common cause of renal failure. Alright, and also to see optometrist, ophthalmologist and also optometrist, alright, because of a risk of diabetic retinopathy as well. I would also like to actually perform an ophthalmoscopy of the eye to look for any kind of abnormality, precisely to look for any microaneurysm which differentiates diabetic retinopathy from hypertensive retinopathy. Other findings I want to look for in the eye, depending on the stage, is to look for soft exudates, which represent dead nerve fibers, to look for hard exudates, which represent lipids spilling out of ruptured vessels, to look for flame hemorrhage, which is more or less bleeding from a ruptured vessel, alright, and also to just check the disc margin to ensure that it's not blood, because if it's blood, then that means the patient also have optic disc swelling, and to check for any macular edema, alright. So those are some things that we also like to find in the eyes, and to see if there's any neovascularization, which is new vessel formation, and that suggests proliferative diabetic retinopathy. Treatment of diabetic retinopathy will be laser surgery. That will be the treatment. If there was an ulcer on the sole of the feet, then I want to describe the ulcer. It could measure 2 by 2 centimeters. Alright, it's circular in shape. The edges, I have to check if it's raised and if the edges are regular. And I also have to check if the ulcer is oozing out blood or pus. Patient has no ulcer in this case. I also want to describe the location of the ulcer and where it's located, but there's no ulcer in this case. Alright, so I would like to do a urinalysis obviously to check for glucose and proteinuria. So with that, I'd like to thank you for the examination. Alright, thank you.